Hello and welcome from Inovi Fertility and Genetics Institute. I hope you're all doing well as we're getting prepared for the holidays. Today I wanted to talk to you a little bit about which vitamins you should take and how you should prepare for fertility from a dietary standpoint. So let's start off with some of the basics. For those of you just joining, I'm Dr. Croats from Inovi Fertility and Genetics Institute. And the first thing we'll talk about is diet. So in terms of diet, what are some of the things that you can do? We hear so many different things from so many different sources about diet and supplements and what is good and what is bad. But there are some basic rules to follow that will help make it easy. So one of the first things that we tell you about your diet is that you should follow a healthy diet. And so what that means in general is that for your diet, the best diet that we know of so far is a Mediterranean diet. So that means a diet that's high in green leafy vegetables, high in omega-3, high in fish, and then also high in carbohydrates that have a low glycemic index. And for those of you who may not be aware of or be aware of what a glycemic index is, a glycemic index is a measure of how fast the sugar from any food goes into your bloodstream. So, for example, when you were younger and your parents told you not to eat something because it had a lot of empty calories, what they really meant is that that food had a lot of calories and probably had a high glycemic index and also didn't have many vitamins that would help you. So for example, glycemic index is really based on white bread that you eat. So plain white bread has a glycemic index of 100, whereas something like orange juice has a glycemic index of 120. And so what that means is if you drink orange juice, a lot of the sugar from the orange juice rushes into your bloodstream, and basically your body cannot use all those calories at once, so it converts it to fat. Something like white rice or potato might have a glycemic index that is around 80. So here's where all of that discussion about low glycemic index or brown carbs is helpful, because brown carbohydrates for the most part have lower glycemic indices, such as brown rice, or even brown wheat or brown pasta, and those tend to have glycemic indices such as 70 or lower. So those are healthy foods, and that is part of eating a healthy diet. Also trying to avoid a lot of unprocessed, or I should say processed carbohydrates. Eating unprocessed is always going to be better. One of the most common foods that is eaten around the world that is extremely healthy in terms of a low glycemic index is eating beans. So lentils especially, they have a glycemic index of around 30. So that's a very helpful food to eat, and that's a very healthy food. So when you're thinking about diets, think about a Mediterranean diet. Like we said, a lot of vegetables, a lot of lean meat, a lot of brown carbohydrates, and that's one of the most important things that you can do. The next thing that we come into contact often, or we often discuss, is what about eating either food or drinking fluid, liquids, water, whatever it is that's coming from plastic bottles. So one of the concerns with plastic bottles is that plastic bottles have something called BPA. And BPA is a chemical that's used to help make the bottles, but in high doses, it can actually cause problems, or has been shown to cause problems in either laboratory animals or in fish or even frogs that are out in the environment that are close to factories making a lot of BPA. So one of the other things that you can do in terms of eating healthy is try to avoid using plastics, especially recycled plastics, when it comes to storing food or to cooking. Now we know a lot of the things that we buy are stored in plastic, and some of that is unavoidable, but if you have a choice at home, if you're able to use glassware and other things to store your food, that will always be helpful in terms of reducing your exposure to BPA or other things in plastics. The next item to consider is what about other things that we do? Common questions come about smoking and alcohol, and generally smoking is not good and can affect your fertility. So smoking is bad for several reasons. One, smoking gets into the fallopian tubes and can affect the ability of the fallopian tubes to carry the egg from the ovaries to the uterus. So it can damage the little hairs that are involved in that process. Smoking is also detrimental to egg quality and also sperm quality. So it can reduce the sperm count, but it also can damage the sperm and damage the DNA in the sperm, and it can lengthen the amount of time that is required for you to get pregnant. So for example, if somebody was eating healthy and they were having intercourse with their partner, they may be able to get pregnant within 10 or 12 months, but smoking can actually delay that process by 50%. So instead, a couple may take a full 18 months to get pregnant. So for those reasons, and of course all the other health reasons, we typically ask patients to avoid smoking. Smoking is also bad for your the health of your blood vessels, the arteries, and can increase your risk of having a heart attack or stroke. And basically smoke gets into all the cells in your body. Now, a lot of people may say that smoking or quitting smoking is difficult, and I would agree that smoking is actually one of the most addictive things that you can do, but any little bit that you can decrease smoking will be helpful. So, for example, if you're smoking a full pack a day, even if you went down to 3/4 of a pack or half a pack, all of that will give you a lot of benefit over the long run in terms of your health and also then in terms of your fertility. Now with alcohol is less detrimental, for example, than smoking, and typically we say a safe amount can be up to 1 or 2 drinks in a day, but any more than that can be detrimental to both the fertility of men and women. And the main way that alcohol is detrimental is because it increases the amount of body fat, and increasing fat is detrimental to both egg quality and ovulation for women, and is also detrimental to sperm quality and count in men. So for the most part, we say that you definitely should limit alcohol to a couple of drinks a week would be ideal. When you're undergoing fertility treatment, during the process of stimulation or during an egg retrieval or prior to a transfer, we really think that alcohol is best avoided. So the next thing on our list after alcohol then would be other drugs. Other drugs are never recommended. They're always bad for your health. As we've already discussed, smoking is very bad. So any marijuana use, especially with smoking, is detrimental. And then we do not recommend anything else. I would say to strictly avoid that. There are no safe levels. Also, another question that sometimes we get is, what about drinking alcohol in pregnancy? That also can never be recommended by any fertility specialist or OBGYN. The exact amount of alcohol that would cause any problems for the pregnancy is not clear because nobody will actually do that study, but suffice it to say it's best avoided completely in pregnancy. One of the best things that you can do, in addition to eating healthy and taking the right supplements and avoiding bad habits, is to exercise. So exercise is very helpful because exercise can help maintain a normal body mass index. And so maintaining a normal body mass index is important because if you have a normal body mass index, that can help you with ovulation, which means releasing the eggs every month on a regular basis. And especially in patients that have PCOS, maintaining a normal body index is critical. For patients with PCOS, which is polycystic ovarian syndrome, which is usually a combination of high testosterone levels and irregular cycles or multiple cysts on the ovary, usually greater than 12 on each side, gaining weight is significantly detrimental and can cause them to basically start to skip cycles. And every month that you skip a cycle is a month that you'll have difficulty getting pregnant or you cannot get pregnant. So exercise is vitally important to maintaining a healthy weight, to being able to ovulate, to produce sperm, and to be able to get pregnant. Now, another thing that we come into contact too is sometimes some men are experiencing low testosterone, which is something that we hear about quite often. And when they have low testosterone, they may have symptoms like fatigue or feeling depressed, or have problems with erections or intercourse. And so when men have low testosterone levels, a lot of them are tempted to go to the local low T center or ask their general doctor what can be done for low testosterone. And after doing blood work and confirming that their testosterone levels are low, they are often given testosterone medications, usually patches or gel, to help feel better. But when you take these kind of supplements, this can significantly reduce your sperm count, and reducing your sperm count, of course, is not helpful to getting pregnant, because we want you to have at least 15 million moving sperm so that you can succeed when it comes to getting pregnant. So if you're ever diagnosed with low testosterone, it's best to see your reproductive endocrinologist, which is your female fertility specialist, or even better is a male fertility specialist, which is usually a urologist with an extra year of training, and they can provide supplements that will be helpful in terms of getting pregnant for men. Now on to the list. Now we hear so many things about so many supplements, and it's actually very hard to wade through all the information because there are so many studies online. Now, just for all of you that like to do your own research, one of the things that I'd like to point out is a lot of times when scientists or physicians or academic people are doing studies, what happens is they may have an idea to test a medication or a supplement, and what they do is they look at a group of people they decide to give the supplement to, or who have taken it on their own, and they compare it to a group of people that have not taken the supplement, and that's called a control group. So when they go ahead and they do these studies, then they compare to see if the people that are taking the supplements have better success rates in fertility or whatever else they're testing, and they compare it to the people that haven't taken it. Now, one of the things that happens is that if you get a result that shows that the study group or the people taking the supplement have no better results than people that are not taking the supplements, then that study never gets published. But inevitably, if you do enough of these studies, one of these studies will show that there is a positive effect, even if there was no real effect. So what will happen is 1 or 2 studies will be published, and then that gives everybody else an opportunity to try the same thing on their patients or other groups of people and see if it works. And then what will happen, or a lot of times what we'll see, is that the supplement, when it's tested in different centers or locations, really doesn't have any effect. But nonetheless, that supplement and the information from the study then will remain accessible to the general public, especially with the internet. So they'll see the study and they'll say, oh, this medication or this supplement was helpful, and therefore we should continue to use it, even if the larger group of studies suggests otherwise. So the information that I'm going to give you today is going to talk about medications, or I should say supplements, that are known to be helpful and have several studies backing it up, not just one study. So probably the 2 most important things that you can consider taking are multivitamins or prenatal vitamins. So what does that mean? Prior to conceiving, it's recommended that women take either a prenatal vitamin or a multivitamin. And the number 1 ingredient that we're looking for in a prenatal vitamin or multivitamin is folic acid. And we want the folic acid levels to be at 800 micrograms per day. And at that level has been shown to help reduce the risk of neural tube defects, which are deformities in the spine. And basically, the reason we tell you to take it at least 2 months before you get pregnant is 2 months is the amount of time that it takes for those levels to go up in the body. So if you were to wait until you're pregnant and get a positive pregnancy test, or wait until you see the pregnancy on the ultrasound, it would be far too late to take the prenatal vitamin, and it would have no beneficial effect. So if there ever was any risk for having a neural tube defect, then you will not be able to prevent it solely with the 800 micrograms that you take when you're 6 weeks pregnant, because by 6 weeks, the neural tube has completely formed in the fetus. Now, if you have a history in your family of a neural tube defect, and neural tube defects are things like spina bifida, or there are some other disorders where the back of the skull is not formed properly, then it's recommended that you actually take 4,000 micrograms of folic acid per day. Other things that you'll see in prenatal vitamins or multivitamins are antioxidants. A lot of them will have zinc, and zinc is helpful for formation of DNA, and they'll have calcium, vitamin C, vitamin E, selenium, and many other things. So helping, or I should say starting to take those beforehand will be very helpful. Another question that we get quite often is, what is the difference between a multivitamin and a prenatal vitamin? You can take either of them actually before you get pregnant, but the main thing is that vitamin A is in much higher levels in a multivitamin. So when you get pregnant, actually you don't want to be taking or don't want to continue taking multivitamins because of the high vitamin A levels, which can be toxic to the pregnancy. So you want to switch to a prenatal vitamin. So one a day is something like Centrum is good for women, and it's also good for men as well because it has many antioxidants in there. And many of you may wonder, well, what is an antioxidant? An antioxidant is any sort of chemical or vitamin that helps reduce something called reactive oxygen species. And reactive oxygen species are forms of oxygen that can go around and damage tissue and damage DNA and cause problems. So when we take antioxidants, that can reduce the number of reactive oxygen species and prevent damage to the DNA of the eggs and the sperm, which we need to help get pregnant. So that's the main thrust of why you should take prenatal vitamins or multivitamins prior to getting pregnant. The next common thing that we recommend is vitamin D. Now, vitamin D is also an antioxidant and an anti-inflammatory, and it's one of the few that has been proven to be helpful in terms of pregnancy and pregnancy preparation. As you know, vitamin D is also helpful in helping you make use of calcium and preventing your bones from thinning. So vitamin D should be taken also within 1 to 2 months prior to getting pregnant. For women that are under 35, typically 1,000 units a day is sufficient. Whereas women that are over the age of 35, we typically recommend that they take 4,000 units per day or more. The daily recommended allowance for women that are not getting pregnant is going to be somewhere around 800 to 1,000. So those are already similar to what you may be taking as well. Another thing to bring up is calcium is important for all women to take, even those trying to get pregnant. And typically those that are before the age of 50 should take 1,000, and obviously those after the age of 50 are most likely not trying to get pregnant, but should be taking 1,500. The next thing I'd like to talk about is CoQ10. Now, CoQ10 you'll see a lot of times in the drugstore, and it's available in 100 milligram, 200 milligram, or 400 milligram tablets. And CoQ10 is helpful for cardiac health, but it's also helpful for egg quality. And CoQ10 is basically part of what we call the mitochondria. And the mitochondria are the little cells in the egg that help with producing energy. And why CoQ10 is helpful is CoQ10 can help with the energy levels in the egg so that when the egg is dividing to form the egg that's going to be fertilized, that it's less likely to have chromosomal errors. Now, what do we mean by chromosomal errors? Well, whenever the egg is actually splitting into an egg and the other cell that comes off the egg called a polar body, part of the problem with age is that the chromosomes are not getting divided evenly between the egg and the polar body. So you're getting an abnormal chromosome count in the egg. So you can have an extra chromosome, which is called trisomy. So for example, 3 chromosome 21s would cause Down syndrome, or you can have a monosomy where the egg only gets 1 chromosome instead of 2. And one example of that is something called Turner syndrome. So by taking CoQ10, we cannot reverse egg quality, but we can hope to minimize some of the effects of age on egg quality moving forward. So the recommended amount for CoQ10 per day is 600 milligrams of ubiquinone or 200 to 400 milligrams of ubiquinol. because ubiquinol is thought to be the form that is more easily absorbed in the bloodstream. Now, the other thing that we see a lot of people taking is DHEA. Now, DHEA is converted into androgens or male hormones in both women and men, but for fertility purposes, it's typically only recommended in women. Now, DHEA can be a helpful supplement in women that have a low DHEAS levels, but if you take too much of it, it actually can work to your detriment when you're doing fertility treatment. So, what are the amounts of DHEA that can be taken? They typically come as 25 milligram tablets, and you should be taking anywhere from 1 to 3 tablets per day. Personally, what I recommend patients do is that they check their DHEAS levels in the office, and if they are low, then we can recommend supplementation with DHEA so that we get the appropriate level, and that can help their stimulation. Typically, taking 1 tablet per day is going to be okay, but I would definitely consult your provider prior to taking 2 or 3, because you may feel that taking supplements is going to be helpful, but in the end, it actually may work to your detriment. Some other antioxidants that are helpful that we've talked about is omega-3. So omega-3 can be helpful because that is what's in fish, and you can also take omega-3 supplements. And as you know, those are readily available in any pharmacy without prescription. Also, prior to starting IVF, melatonin can function also as an antioxidant, and that can be taken in the week prior to IVF once daily prior to starting with treatment. Other things that we often hear about that are helpful are vitamin E, vitamin C, alpha-lipoic acid. All of those are supplements that you can buy in the pharmacy and you don't need a prescription. For vitamin E, the typical dose is 200 units per day. And for vitamin C, we typically recommend 500 to 1,000 milligrams per day. The alpha-lipoic acid you can take as 400 to 600 milligrams daily as well. And that is helpful for both men and women. So, and then finally, for patients that have PCOS, there is something called myo-inositol, and myo-inositol can be helpful in reducing insulin resistance, which is part of the reason that patients with PCOS have problems getting pregnant. And then they can also take L-carnitine. For men, as we talked about, taking multivitamins can be helpful because multivitamins have a range of different supplements that are helpful for men. The ones that are specific that are helpful to men, though, and are found in male fertility supplements such as Fertility include zinc and CoQ10 and L-carnitine, among others. So either take a multivitamin, or you can go online to CVS and Walgreens and find Fertility, which is a highly recommended vitamin that can be taken for men. And of course, if you ever have any questions, you're welcome to reach out to us. We're happy to help guide you in the supplements. Typically, when patients come to our office, we provide them with a list of supplements that they might find helpful. And many of them use this as a guide to go out and purchase the supplements that they would like to use. So with that said, I wanted to thank all of you for joining. We've enjoyed having you here tonight. And if you have any more questions, please don't hesitate to reach out. We can be found at inovifertility.com. And I wish all the best of you in your planning your future for your family. Thank you and good night.